Most vaccinated people will probably require yet another COVID-19 vaccine booster shot in the fall, a top Food and Drug Administration official said Monday. That's when we'll probably have a fair amount of waning immunity in combination with likely further evolution of the virus along with people going. Marks says the country must start planning now for whether everyone needs another shot and, if so, what kind of shot exactly. We could basically wait until another wave comes along and then try to make another vaccine and try to deal with it, but I think we know that doesn't work, because we can't man. The FDA is convening a special meeting of the agency's independent outside advisors Wednesday for a day-long meeting to begin to plan the next round of boosters. The meeting comes about a week after the agency authorized the fourth shot, the second booster, for anyone age 50 and older to shore up immunity ahead of a possible new surge sooner than the fall. A more contagious Omicron subvariant known as BA.2, which has fueled surges in other countries, is now dominant in the U.S., raising fears of another surge. The tricky part of determining what to do in the fall is determining what version of the virus will be dominant by then, Marks says. It could be Omicron variant, but it could also be an entirely new variant. That raises doubts about just giving people a fifth shot of the current vaccine, he says. There is a certain diminishing return by giving the same vaccine over and over, Marks says. We have had enough evolution of this virus that it would make sense to want to try to cover some of the genetic diversity that has been introduced into the mix. One strategy would be to give people a new vaccine that specifically targets Omicron or one of the other variants, such as Beta, Marks said. Another option would be a new vaccine that combines at least two different strains into one vaccine, which could provide even broader protection against any new variants that might emerge. By this fall, we may be onto a new variant. It could be Sigma. It may be Tau. There may be something new that may be circulating that we'll have to deal with, Marks says. We're going to have to make a good guess at what may be most effective. That's how the flu vaccine is formulated each year, though that virus is more predictable than SARS-CoV-2. So far, an Omicron version of the vaccine hasn't produced very promising results in early testing.